Hello and welcome everyone today at our second symposium at AMWC. We're the midway. So we're happy to see you today. I guess we're still waiting for some doctors to join us, but because we have very intense schedule for the session today, we will not delay any further the start of our symposium. So my name is Gouri le Dr Han, and on behalf of Dixlevo, I welcome you. And I would like to invite our speaker, Dr. Paul Han from Australia, who's going to share his experience with various Gouri cases. And after the presentation, we will be having live demos, so make sure to stay until the end. Thank you.
Thank you all. Hi, my name is Dr. Paul Han. I'm a cosmetic physician from Sydney, Australia. I've been in the industry for close to 20 years now. I think it's a small group, so I think we can be a little bit more interactive. Can I just ask who knows about Gouri? Everyone knows about Gouri? Knows about it? Or used it? Used it, okay. I think there's a few people who doesn't know about it, so I'll just briefly explain before I go on to the presentation. So for those of you who doesn't know about the collagen stimulators, in the past there has been so you can broadly divide the collagen stimulator into one with the microsphere and one without the microsphere. And existing products, they're all microsphere form, meaning they have particles. They have, it's in powder form and you have to reconstitute. You need a mixing time, and because there's particles, the clumping of the particle can cause nodule formation, and it can block up the vessel and cause a major vascular obstructive events. So that's the problem with the collagen stimulator. Any high polymer material starting with P, so PCL, PDLLA, PLA, anything starting with P, they're all microsphere form. Now, the reason how I came across this product is actually 2 years ago in Monaco. So they won the award for the best collagen stimulator of the year 2 years ago. So I thought I might just contact the company and just have a trial of the product. And since then, I got addicted to this product because it's so safe to use and so simple to use compared to the other product. In my clinic, I don't want anyone to have nodules or vascular obstruction. So I want to keep it that way by using a fully liquefied version. So for you to understand easy, basically all the hard ones, microsphere forms one are in powder form. You have to mix it, reconstitute it. And if you leave it long enough on a stationary, it will form sediments. So it's heterogeneous. So you get the water forming above and you get the sediments forming. And those are dangerous, okay? It can cause nodules and vascular obstruction. Whereas Gouri, it's the world first fully liquefied PCL. So as I've been showing you during the live demo, I'll show the syringe. They will never form, it's fully solubilized within water. So they spread very quick, and that's one of the advantages. And they will not cause nodules because they are evenly distributed and doesn't cause nodules. And because there's no microparticles to cause vascular obstruction, this is the most safe collagen stimulator out there for you to use. So let's go, so I think I explained for those of you who doesn't know about this. So basically I explained that before, so they evenly spread. So all you need is 3 lines to cover the whole face. So so 3 lines, 1 ml per side, 1/3 of a ml will give you full face neocollagenesis effect without having to mold the product. So what I do is I just go in and out 1/3 of a ml, 1/3 of a ml, and 1/3 of a ml, 6 lines per whole face, and it will give you whole full face neocollagenesis effect. Existing product, because they don't spread, you do have to go through, you have to fan it, and that will cause fibrosis. So the result you're getting with the microsphere ones, there is some scarring and fibrosis associated with it. Because Gouri, we just need 3 lines for the whole face and there's no need to mold. Very simple and very easy and very safe to use, okay? So, I've been using Gouri for close to 2 years, so I have very long-term. So if you're a user, there's no doubt about the result. Everyone knows it works. Now, this is a special case. So usually if I didn't have a collagen stimulator like Gouri, I would have done some sort of IPL treatment to treat her rosacea. So what I did for her, I just did a Gouri, and then this is the result of the rosacea with the IPL, it doesn't last more than, everyone has to repeat that every 3 to 6 months. The rosaceas come back. But the rosacea result that I get with Gouri is close to 1 year. As long as the PCL is there, the results is still there. And PCL, as you know, is the strongest collagen stimulator. So that's why it gets a longer lasting result even after 1 year. So the rosacea result is still strong after 1 year with just single session with 2 mils for the whole face. Now this case is also on rosacea, so very good result, good whitening results. I'm getting good result with the deep dermal pigmentation such as melasma and PIHs, not so much on the epidermal lesions such as your sunspots and freckles, but you do get great result in terms of whitening, melasma and PIH and rosacea. This is the same person on the other side. Now, unfortunately, the Visia doesn't show the tightening results. So when I take a picture, I normally take one with the Visia and one with the normal picture to see the shadowing and the tightening and the lifting results with the Gouri. So when I normally do the Visia, this is sort of the result I get. On average, I get 4 years off their skin age. So when I do a single session of Gouri, this is consistently I get 44 years off their age, their skin age. So now this is on the melasma as well. This is without any help of any picosecond lasers or Q-switch Nd:YAG lasers. So I just did Gouri for her, and this is the result on the deeper hyperpigmentation. As you know, Australia, I'm from Australia, a lot of Australians love sun, and these are the typical young Australian people in their 30s, unfortunately, so there are a lot of sun damage. And this is, all I did for her was a 3-line this way, and this is the result after 1 session, 1 month later. So huge improvement in skin texture, brightening, and lifting and tightening results all over. Now, this case is very special. All my clients been coming to me for more than 10 years. So this is a PicoSure and PicoSure resistant PIH. I've tried around 10 sessions on her neck. It never worked. Maybe lightened a little bit. But when I offered her to do a Gouri, but she didn't actually do the Gouri treatment to get rid of the PIH. She wanted to rejuvenate her neck, so I offered her Gouri. And a few days later, amazingly, not a few weeks, well, a couple of days later, she called me and PIH is gone. It's too good to be true, but this happened. So I treated her face and the neck, so as you can see, most of her deep pigmentations lightened or disappeared altogether. Now, this is a 40 to 50-year-old Asian lady. This is a typical result that you are expected to tell your client and to see the result on your client. Now, when she first came in, if I didn't have the Gouri, she asked me to fill her T-trough, get rid of her nasal labial fold and marionette line, and also she wanted to tighten the pores, and she wanted to get rid of the hyperpigmentation. So in the past, I would have recommended to do a combination treatment, bit of filler, bit of some skin laser to tighten her pores and get rid of the pigmentation at the same time. Instead, I actually offered her 1 session of Gouri. This is too good to be true. So it has a lot of shadow deleting effect. So I call it a shadow hunter. You're not getting the shadow deleting effect from the filling result. It's from the skin tightening result and skin thickening result. So it gets a very natural result without the shadows. And as you can notice, the pores significantly reduced and her hyperpigmentation's almost 80 to 90% gone. So she's very happy with the result, and what she does is she does every 6 monthly maintenance Gouri sessions forever, and she gets some toxins done for her upper face. So similar, another young Australian sun damaged skin. So I didn't do any picosecond lasers to treat her melasma. So I just offered her a Gouri, and this is amazing result in terms of the PIH, her skin texture, and on the scars as well. So this is the other view. So I just want to show you the other effect that you get with the collagen production with the Gouri. So same, exactly 4 years off after 1 session. This is the other side, 4 years off on the other side. Now the next one is an interesting case. This client has been coming to me for many, many years. She's tried everything. I'll show you this one first. She's a lifetime eczema sufferer. She's tried everything in the world with her dermatologist. Nothing worked. I've tried everything in my clinic. Nothing worked. Just helped a little bit. She always gets once a week severe acute phase like that. And when I saw her, she was in that state. And then I actually injected Gouri for her. And then amazingly, within a week, all disappeared. It's very good for the chronic skin changes, PIH, scarring, and actually she's in remission for 6 months. So she called me after 5.5 months. She said she started getting some itchiness, so I told her to come back. So I did a second session for her, and then she's still in remission for another 6 months. So I'm actually offering her every 6 months Gouri to treat. Now this is the same lady on the neck, so very good for chronic skin changes like that, PIHs. Now, because I've been using it for a while, I wanted to show you the long-term result of Gouri. Now, so this, if you look at the date, this is she had only 1 session done. She used to come more regular. She used to come to me every 3 or 4 months. And she didn't come. That's why I called her, is there something wrong? And she said, no, the result was too good. So she came back 1 year later, and if you look at her, she still looks younger than a year before, without any treatments. This is another case. This gentleman has been coming to me for many, many years. Regularly, every 4 to 6 months, he gets Icon, which is an IPL for his superficial pigmentation and the rosacea, and he gets regular toxin done, and he gets once in a while dermal filler done for his nasolabial fold and the marionette line. So he's been then following that regime for maybe 10 years with me. 2 years ago, I offered him a Gouri. I didn't do any toxin. And the second picture is actually after 1 year. So the rosacea result is still strong after 1 year. And if you look at the crow's feet, the severity of the crow's feet is still much less than 1 year after. So he's actually doing every 6 monthly Gouri maintenance session as well. Now this is a combination case. Interesting case, very hard to treat. So you see that festoon on her cheek. Now, interesting story, she had a gastric sleeve done and to lose her weight, and then she lost 40 kilos in 1 month. So you can imagine her skin condition is not that great, very bad. So normally I can just go put a filler. She asked me to give me the volume backs, but I actually asked her to get the collagen going first and fill it up. So this is a case where I did Gouri first, and 1 month later I put a filler for her on her face. So as you can see, the first picture is before, second picture is 1 month after. As you can see, there's a significant wrinkle reduction on her under eye area with the Gouri. And if you have a close look, her scars on the frontal cheek is much improved as well. And then after 1 month, I actually put some fillers to give the volume back, because Gouri is not a volumizer. Okay, so it's a skin tightening. It doesn't give you volume. And this is final result after 1 session of Gouri and 1 session of filler. So she went a long way from here to here. Okay, this is also an amazing case. He's still my long-term client. He was a mess when I first saw him. He said he wanted to get back to his normal life. He didn't want any dermal filler, so I asked him to gain some weight. So he gained about 4 to 5 kilos, and I did a series of morphisate, 3 sessions of morphisate, and 3 sessions of Gouri. And this is the result that I'm getting. So it changed his life so much. He thanked me all the time to make him change from there to there. So from the front face, now this last picture was recent. I actually did a few other treatment after that. What I did different when he came in a few weeks ago was I did another session of morphisate, I did another session of Gouri. I also combined with the exosome. So I don't think I'm showing this one in this picture, but maybe next time I'll share with you. I do have morphosite, Gouri, and exosome. Now, the inward company, Gouri, Dexlevo, and the Execo Bio company, we tried to come up with some good combination treatment. So this is something I came up with. So I did a morphosite, this is only a couple of months ago, 2 months ago. So I did a session of morphosite after, and then I put 2 ml of Execo Bio exosome as a topical because it's already created a microchannel with the morphosite. So all you need is a bit of topical application with the 2 ml, but I also want to get very strong result with the exosome, so I also do subdermal injection. So 3 ml, the rest of the 3 ml out of 5, I inject. So morphosite, 2 ml exosome topical, cool down, I do 3 ml subdermal exosome straight away, and straight after I do Gouri, 3 lines using cannula. So everything was done on the same day within 1.5 hour period. And this is the result after just 1 month. As you can see, her crow's feet. The result is very quick. So by combining exosome, I think the result, everything becomes very quick because both Gouri and exosome is a very powerful regenerative medication. So, but they're a powerful collagen stimulator. As you can see, her melasma result, so I'm getting very consistent result with the melasma, with the combination of Gouri and exosome. So huge improvement with the deep wrinkles, under eye improvement. You can see the skin close-up of the under eye fine wrinkles, very smooth. But I'm expected to get more result over the next couple of months. So I've done a second session for her and I'm waiting for her final result. Now this one. So when I'm doing a before and afters for any company, I try to pick a virgin client from any aesthetic procedures in the past. So she hasn't done any procedures in the past. So when you want to see a very great result, you have to the client selection is the most important thing. If you pick the right client, you will get massive result. If you pick a wrong client, they will see so-so result. So this client, I knew she was going to get a great result. So what I did for her, I did exosome first, subdermal injection all over, and then using cannula, I used 2 ml for the whole face. And this is the result after 1 month. Her melasma is completely gone. I thought I took the after picture in the wrong room, but when I checked it, it's in the same position, the same lighting. So this is the result of combination treatment of Gouri and exosome on the same day, and it is just after 1 session. Massive result. Now, I'll be doing a live demo, so I won't go through this slide too much. I think we can leave this slide up, and then, no? Okay. So basically, when I go to the injection room, I will show you this, so this is not really important. I will explain when I'm doing the live demo. Okay, thanks for listening, and I'll see you shortly.